In many communities, there is a need to bridge the gap between citizens and government. Despite commitments that should guarantee essential services to children and families, challenges in basic service delivery persist. Local health clinics do not have enough basic medicines or health workers. Public schools lack the right facilities and may be overcrowded. Such communities resemble many places where World Vision serves. Citizen Voice and Action, or CVA, is World Vision's approach to social accountability. Through CVA, communities are empowered to create meaningful conversations with governments that will help improve services on health, education, child protection, and disaster risk reduction, which impact the daily lives of children and their families. Communities are equipped with simple tools so they can engage their local leaders in a dialogue and together agree on ways to improve delivery of basic services. CVA has 4 basic elements: information, voice, dialogue, and accountability. Since 2005, hundreds of public services have been transformed by the hard work of communities using CVA. In the Philippines, it has been used by communities to help tackle the issue of malnutrition and deaths of children under 5 by intensifying breastfeeding support. In other communities, it has also been helpful in urging local leaders to proactively carry out disaster risk reduction and management programs in their localities. Proven effective, CVA can help communities play an important role in achieving desired outcomes for children's well-being. So how does CVA work? It is divided into 3 phases: enabling citizen engagement, engagement through community gathering, and improving services and influencing policy. Now let's start with the first phase, enabling citizen engagement. This is the part where citizens are given the right information so they know how to act and engage with governments. In this phase, communities will learn about basic rights, the role of government and citizens in delivering the public services at stake, and government standards. These standards are based on the existing national or local policies, such as national laws, executive and administrative issuances, among others. An example of a standard as stated in the Republic Act 10121, or the Philippine Disaster Risk Reduction and Management Act, is the establishment of a functional local disaster risk reduction and management office. Then communities will be able to assess and compare if current practices fit the standards. During the enabling citizen engagement phase, communities establish their group as a CVA core team, who shall take the lead of the whole process. Together, community members, including children and youth, work in bringing about change in their community. As a result of this stage, they are now prepared to engage governments in a constructive and productive manner. This happens in the second phase, engagement through community gathering. This is the heart of the CVA process, because this is when communities and governments evaluate the quality of public services and identify ways to improve delivery. The CVA core team and local leaders will first meet to introduce citizen voice and action, its processes and expected outcomes. This will then be followed by a series of meetings, during which they will collaborate to compare standards with actual conditions using simple monitoring tools. Through community education, community members will be taught the standards that the government is mandated to comply. Then, using a simple scorecard tool, they will compare these standards with the actual services rendered. It works like a satisfaction meter, which is meant to gauge the level of satisfaction of the community to the public services monitored. Service providers will also undergo the same process to measure their satisfaction level on the quality of services that they have delivered. For instance, participants would be asked what an ideal birthing clinic might look like, and then compare it to what is existing in their community. After the scorecard process, service users and providers will make recommendations to help improve services at this stage. This will be presented in an interface meeting with local leaders wherein the government, CVA core team, and community representatives plan actions desired to bring change and improve performance. It is crucial that both the community and service providers develop this plan together to ensure mutual accountability. CVA aims not only to improve services, but also to transform the relationship between the government and citizens. Through dialogue, relationships within the community are both restored and strengthened. Now, the last phase is improving services and influencing policy. During this stage, communities, government, and service providers carry out the action plan. To maximize impact, citizens and other stakeholders also take part to influence policies, advocate to decision makers, and to ensure that the action plan is implemented. Once communities see that success is sustainable, they repeat the monitoring process and focus on other complex issues. The CVA process then continues, sustaining a good working relationship between communities and governments over the long run.